Today it's going to be a two-part. This is part one of my two-part section that I'm going to do on knocking down cholesterol. This is a biggie, guys. This is a big thing in primary care. And the main reason why it's a big thing is because heart disease is the number one reason why people die of sudden death in the U.S. today. Heart disease, also known as blockage in the coronary arteries, also known as a heart attack. So this is a very important section of It's My Health, and I'm going to take my time and break this down for you guys because I want you guys to have a clear understanding of what cholesterol is and why cholesterol is so important to your health and why we screen for this. And when you couple high cholesterol with diabetes and obesity, it can really be a problem. It can be a huge problem. So today I'm going to break down the three major lipids that we look at. Okay, when I use these words interchangeably, I want you guys to know what I'm talking about. So if I say lipid panel, I'm talking about cholesterol panel. If I say cholesterol, I'm talking about lipid, because I want you guys to really understand this and have a very clear and precise understanding of this so that you can better help yourself. Because I always believe, guys, that when you learn better, you should what? Do better, right? So without further ado, let's get to it. All right, guys, so let's talk about the three main parts of the lipid panel, okay? Cholesterol panel. If a doctor comes to you and says, hey, I want to check your cholesterol, or I want to run a lipid panel, this is what they're looking at. I won't go into, there are some other factors within the lipid panel that we also look at, but I'm not going to talk about those things. I'm only going to give you the three major parts of the lipid panel that we hands down always look at. This is how we treat you when we're giving you medications, when we're writing for drugs, and we're trying to get your numbers right. These three that I'm going to talk about right now are the three that we're looking at. Okay, the first one is called the LDLs. The LDL stands for low density protein. Okay, lipoprotein.
Hey guys, I want to pause right there because I want you guys to understand what I was saying by what I meant by lipoprotein. It's pronounced lipoprotein. I know I was saying lipoprotein, but the correct terminology is lipoprotein. Okay, so I just want to make sure you guys understood that. But back to the video.
That's what the LDL stands for. Whenever lipids are traveling, need something to attach themselves to so that they can move freely through the blood system. Okay. They attach themselves to protein, and that's how they travel. What happens is when you have too much lipoprotein in your red blood cells, they start to stick to the walls of the coronary arteries. Okay, I'm gonna pop a picture of the coronary artery up above me so you can see exactly what a coronary artery looks like. Okay, but that's the first one. That is called your LDL. It is also known as the bad cholesterol. Okay, that's the one that you want to keep that number really low as possible. Anytime you go in to the doctor's office, you want to know, he says he run a lipid panel on you, you want to know, what's my LDL? Okay, you want to know that. All right, a normal LDL needs to be 99 or less. Okay, if you start getting up in the 150s, 200s, I'm praying for you. Okay, that is way too high. You are really at risk for heart attack or at risk for a lot of multiple blockages. Okay, if your LDLs are hanging out always in the 150s, 200s, 250s, 300s, that is way too high. Okay, the second part of the lipid panel that we're looking at, all right, is the HDL. That is called the high density lipoprotein. Okay, that's what the HDL is called. You want to keep that number high, because with the HDL, they kind of clean up the artery a little bit. They clean it up and they keep the flow of the lipoprotein going through the coronary arteries and keeping you from building too much LDL, if that makes sense. So a normal HDL would be around 35 to 65. And the third one that we look at is triglycerides. Now, triglycerides are tricky, y'all. It's the third component of the cholesterol panel, and it is the one that we do look at the triglycerides as well. But a lot of times providers will focus primarily on the LDLs. I do think the triglycerides sometimes they fall through the cracks a little bit as far as patient education and teaching patients how to manage their triglycerides. And we have seen atherosclerosis and heart attacks form and cause from elevated triglycerides that are just way too high. Because when the triglycerides get way too high, even if the LDLs are managed well and they're low, that triglycerides can be a problem, and they can cause a heart attack. They can be a problem. So don't ignore the triglyceride. I know a lot of providers like to kind of, they let triglycerides get well in the 250s. I've seen some people come in with triglycerides in the 400, and no one thinks they need to be treated. Excuse me? Yes, they do. Okay? Yes, they do. I have seen people have open heart surgery from elevated triglycerides, and LDLs were normal, HDLs were good, but the triglycerides were through the roof. So please do not think if your triglycerides are high but your LDLs are low that you're great and you're fine. No. But I'm going to explain to you how what elevates each part of the lipid profile, okay? With the triglycerides, which is why I say they can be kind of tricky. Triglycerides are primarily elevated from people eating too much foods that are either starchy or high in carbohydrates. Or you could have a predisposing issue such as obesity or diabetes. If you have diabetes and you have obesity on top of that, a lot of people I have treated have had elevated triglycerides. I tend to be a little bit more aggressive with those patients because whenever you have high cholesterol coupled with obesity, coupled with diabetes, that is a recipe for a heart attack. Okay? Let me say that again. If you have diabetes, obesity, you're overweight, and you have elevated cholesterol, triglycerides, or elevated LDLs, you are in the what we would call the high 90th percentile for having a heart attack. With someone that have all three factors, all three components like that, I tend to be a little bit more aggressive with the treatment plan for them because I want to prevent them from having a heart attack. I kind of look at obesity and diabetes and high cholesterol as all being families and friends. They're cousins. They're all related. They all go together. And most people that have a heart attack have either two of the three or they have either two of the three or all three is what I've seen. Okay. And then there's also your predisposing factors like genetics. Okay. We won't talk about genetics. Yes, there are people have been avid runners. They've exercised all their life, ate healthy, and still had a heart attack. And still had open heart surgery. Yes, I've had patients like that too. But again, those people are in the low 5, 10 percentile. They're in the low range. They have a family history of it. The mom and daddy had it, sister had it, whoever in the family, all of them had it, and they were just bound to get it, okay? Because it was so strong in their bloodline. Maybe it's not a genetic thing. That's what I'm talking about, okay? Because what we're seeing is a lot of this high cholesterol is brought on from the food choices, the types of food that people are choosing to eat, okay? So I'm going to go down and tell you what causes elevation in the LDLs, okay? So what causes the elevation in the LDLs is foods that's high in saturated fat. So like if you're a big butter eater, if you like milk, whole milk, is very fattening. Not eating the skin on chicken can run up LDLs. Eating a lot of fried foods can run up LDLs. So these are things, foods that's high in saturated fat. If it's been dipped, fried, deep fried, it is high in saturated fat. Those things run up LDLs. Hot wings, French fries, running up LDLs, okay? Okay, what runs up triglycerides if you don't have diabetes and obesity, because those two right there can run up triglycerides. But let's say you don't have that and you have elevated triglycerides. Maybe you're taking in too much starchy foods that's storing as a sugar. Sugary drinks can run up triglycerides. If you have a high saturated diet, let's say you have a diet that's high in saturated fats, we have seen the triglycerides go up as well as the LDL. So we'll see both of them go up at the same time if you're eating, let's say, foods that high in carbohydrate, foods that are high in starchy foods. So let's say a starchy vegetable would be peas, sweet peas would be a starchy vegetable. Another one would be corn. Oh, beans. That's a big one. That's one a lot of people like to eat when they decide they want to cut out meat. Beans, those baked beans that's soaked in like maple syrup and sugar. Yeah, those, if you eat a lot of that, it can run up triglycerides. White bread, white rice, pastas. They're taking in a lot of fried foods, fried fish, fried chicken, French fries. They're taking in all that, and that's what's running up the triglycerides, and that's what's running up the LDLs. You need to lean more towards stuff like kale, these green leafy vegetables, not your vegetables that are in a can. Go more towards the fresh leafy vegetables, okay? And when you're trying to manage the LDLs, you want to stay away from the fried foods, okay? So with the HDLs, and I didn't talk about the HDLs because I want to hit on that right quick before I end this video, because I'm going to split this up into two parts. The second part, I'm going to cover some foods and things that you guys can do to help lower this cholesterol. The HDLs, this is your good cholesterol, the HDLs. We want the HDLs around 35 to 65. Now, understand too, if you have an HDL that is extremely low, that can be a problem too, because I'm probably going to start looking more at your thyroid. I'm going to want to know why your HDLs are so low, because we want the HDLs up. Keep your HDLs high. The LDLs need to be low. So when the HDLs are extremely low, like less than 35, I'm wondering if you have hypothyroidism. It's the thyroid overworking where you're not able to store fat or hold fat, because you do need some fat in your body. You need to hold on to some fat, okay? Some of the fat is needed in your body. Your heart needs a certain amount of fat. The liver makes some of this cholesterol, but remember too, when your liver is making too much cholesterol, it does not know what to do with it. It starts collecting on the liver, which is also known as a fatty liver. So you don't want a fatty liver either, because people that have a fatty liver, normally 9 times out of 10, that's high cholesterol. They start to develop something that we call Arcus Senilis. Okay, Arcus Senilis is when, if you ever seen, it's very common in African Americans. If you ever seen an African American that has like a gray ring around the eye, if you look directly into the eye and you see a gray ring that's on the outside of the color of their eye. Eye looks brown, but then there's like a gray ring that's hanging around that eye. That is an indication of high cholesterol, okay? So that's called Arcus Senilis, okay? So if you guys, if you see something like that, that's what it is. So if you see yourself developing something like that, you might want to ask your doctor to check your cholesterol. You screen for it. You should be screened every year on your annual physical. And that's why I'm kind of trying to educate you guys on what questions to ask, and so you'll know what you need to know. And when those numbers are repeated to you from your doctor, when they present those numbers to you, you understand what they're saying to you, and you're not hearing womp, 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 womp. And then you leave right out of there and stop by Miss Winters and get you a 10-piece. I'm just saying. Guys, I hope this video was helpful to someone. If you enjoyed this video, please give it a thumbs up. And don't forget to check back for part 2 of knocking down cholesterol. We need to change those things so that you can do better. You can live longer and healthier lives. We can lower your risk for heart disease and heart attacks and things of that nature, guys. So until next time, I'll talk to you soon. Bye, guys.